NU 673 Final Clinical Journal Reflection. At the beginning of the semester, I set several personal, academic, and professional goals for this clinical experience. I wanted to strengthen my ability to complete psychiatric assessments and differential diagnoses, expand my competence in evidence-based psychotherapy and psychopharmacology, improve my therapeutic communication, and continue developing leadership, advocacy, resilience, and the ability to seek support when needed. Looking back over the semester, I believe I made meaningful progress toward these goals, and I have every intention to continue that progress. My reflections show growth in diagnostic thinking, medication-related clinical reasoning, therapeutic presence, and a great growth, I think, in self-awareness. I also became more aware of the importance of reflection as a tool for improving both my ability to provide patient care with professional development. Overall, I believe I met many of the goals I established, while also recognizing that growth as a future psychiatric mental health nurse practitioner is ongoing, of course, and will continue well beyond this semester. Throughout this clinical experience, I encountered feelings, biases, and internal reactions that required reflection and professional management. One of the most important moments involving recognizing a subtle sense of skepticism during a patient encounter with an individual who reported a complex trauma history. I realized that this internal response reflected countertransference and the influence of diagnostic habits that prioritize clarification and reality testing. Through reflection, I recognized that my role was not to determine whether every traumatic event occurred exactly as described by the patient, but to respond to the patient's suffering, symptom burden, and need for compassion, trauma-informed care. This experience helped me to manage my bias by intentionally redirecting myself toward empathy, patient-centered care, and ethical self-awareness. It reinforced that good psychiatric practice requires not the absence of bias, but the willingness to identify it and prevent it from inhibiting and influencing my clinical judgment. I also experienced anxiety and uncertainty during the semester, especially when observing complex cases in which symptoms didn't fall neatly into simple categories or classifications. A meaningful example was a follow-up visit with a patient with bipolar 1 disorder with mixed features, where depressive symptoms coexisted with activation and impulsivity. This encounter challenged my tendency to think of bipolar disorder in more separate categories of depression versus mania. Managing this uncertainty required me to slow down, observe carefully, trust the clinical process, and tolerate the discomfort of not having overly simplistic answers. I learned that anxiety in clinical practice can be managed through preparation, reflective thinking, close observation, humility, and guidance from experienced providers, most especially my preceptor. Rather than seeing uncertainty as a weakness, I began to understand it as part of becoming a safe and thoughtful practitioner. One of the most significant insights I developed during this clinical experience was a deeper understanding of the therapeutic relationship. Across my journals, I repeatedly returned to the importance of connection, validation, and presence. In one particularly meaningful reflection, I described reconnecting years later with a patient I had once cared for as a nurse during repeated psychiatric admissions, and later when I was able to work with this provider in a detoxification setting. This experience reminded me that even when providers don't witness immediate recovery, the compassion and respect offered during earlier interactions may still matter deeply to the patients. The patient's gift of a drawing that he had provided to me and our later shared reflection on his progress reinforced for me that small moments of kindness and recognition can have lasting meaning. This strengthened my understanding that psychiatric care is not only about symptom reduction and treatment plans, but also about hope, dignity, and the long-term impact of human connection. Another major insight that I gained was that patients' behaviors often reflect deeper cognitive and emotional barriers rather than unwillingness. In the bipolar follow-up encounter that I had described earlier, I recognized the difference between knowing what should be done and being psychologically able to do it. And I think this is reflected in everyone. That observation deepened my understanding of how depression can impair motivation, executive functioning, and behavioral follow-through. It also challenged my own tendency to want to solve problems too quickly. I learned that patients often need validation, pacing, and manageable steps before they're ready to act. This insight will influence my future practice by reminding me to meet patients where they are, avoid judgment, and focus on realistic collaborative interventions. Reflective practice has clearly impacted me as a person, as a student, and as a developing provider. Personally, it has made me more humble, which I needed, and more willing to examine my thoughts and emotional responses honestly. As a student, reflection has helped me connect coursework, theory, and lived clinical experience in a way that's deepened my understanding of psychopathology, therapeutic communication, and provider self-reflection and awareness. As a future psychiatric mental health nurse practitioner, reflection has strengthened my recognition that the provider's internal reactions, demeanor, and communication style directly affect the therapeutic environment. Reflective writing helped me identify both strengths and limitations, including my empathy, observational skills, and commitment to patient-centered care, while also highlighting my tendency at times to move too quickly toward problem solving. This process has made me more intentional, more self-aware, and better prepared to provide ethical and compassionate psychiatric care. I will absolutely continue to use reflection in my future practice. Reflection supports clinical growth because it helps provide providers to examine biases, improve decision-making, process emotionally significant encounters, and remain grounded in compassionate care. In psychiatric practice especially, reflection is essential because patient interactions are often complex, emotionally layered, and influenced by interpersonal dynamics such as transference, countertransference, trauma responses, and stigma. In my future role as a nurse practitioner in the psychiatric mental health field, I plan to continue using reflection through journaling, supervision, peer consultation, and intentional review of meaningful patient encounters. I believe reflective practice will help me preserve empathy and strengthen my clinical judgment, and to help remain accountable to the kind of provider I hope to become. In summary, this semester has reinforced that becoming a psychiatric mental health nurse practitioner involves far more than gaining knowledge about diagnoses and medications. It requires ongoing self-examination, emotional maturity, therapeutic presence, and the ability to learn from each patient encounter and grow from those encounters. My clinical reflections showed growth in confidence, insight, humility, and professional identity. They also reminded me that psychiatric nursing is grounded not only in evidence-based treatment, but in the healing potential of human connection. As I move forward, I will carry these lessons with me and continue to use reflective practice as a foundation for lifelong learning and compassionate psychiatric care. And I appreciate the ability to use this tool as a foundation in this course, as well as a foundation in my practice.